on the table tonight. And joining me to help us through it all, two doctors joining us, two infectious diseases specialists, Dr. Lynore Saxinger and Dr. Raywat Deonandan. Hello to the both of you. Dr. Deonandan, maybe I'll start with you. Just a really basic question. In the overall kind of arc of where we are with this pandemic, beginning, middle, end, where are we?
We are in the first half of the first inning of a 9-inning ball game. So we've seen the first assault on our societies come to a close to some extent as this first wave comes to an end, but we're seeing a shift in responsibility. I'm fond of saying this is no longer the domain of doctors and scientists. Now the burden of responsibility shifts to the citizens to hold down the fort by doing responsible things. So now we're just trying to hold the caseload down and wait the number of months or years even until a viable solution, strategy, therapy, vaccine manifests.
Right, and I mean, we're in the first inning, and yet so much has changed in that time. Dr. Saxinger, just on the question of transmission, I mean, I guess we knew early on that the biggest threat was people, not things. And yet, I mean, a lot of us were preoccupied with things like wiping down our groceries, not touching door handles, not touching newspapers. How has our thinking evolved on that?
Well, I think a lot of early actions were driven by unknowns and driven by fear. But at the end of the day, this disease is spread from people who are infected, usually people who unwittingly are spreading it to others before they have significant symptoms or without really pondering the significance of their symptoms, if that makes sense. We're a society that tends to just keep on going in spite of nuisance symptoms, and we have to stop doing that. And so sharing airspace, sharing close contact, prolonged time, indoors time, are the things that keep on emerging as being the biggest risk for transmission. And I think that, being excessively paranoid about washing your vegetables with bleach or soap, really it is almost activity that's misplaced, because you should be spending your time thinking carefully about how many people you're in contact with, trying to keep that 1 to 2 meters away, properly using masks and washing your hands a whole lot. And that budgeting of your time and your effort, I think, is what we need to do to get us through the next part of the pandemic.
Because do we even know of certain cases where surface transmission was the culprit, or even in a large volume of cases?
That's always kind of we didn't find anything else, so it might have been fomite transmission. And there have been a few case theories where they suggest that based on the fact that people didn't appear to have a lot of airtime together, but they were handling common utensils or surfaces, that might have been the case. But to be honest, it has not really been shown to be a major transmitting factor. And although there were some early studies showing that you could actually recover a virus off surfaces for quite a long time, they use really, really high concentrations of virus that would exceed what people would usually emit their own droplets. Right. And so even that's a little bit unclear.
Dr. Deonandan, on treatments, where are we at? How effective are they?
Well, we have a couple of treatments that everyone knows about. The remdesivir is known to diminish severity by some extent. Now we have dexamethasone, which is known to might be the salvation for individuals who are having a hard time with this disease. And convalescent plasma, that's the spun down antibodies extracted from an infected person, not the antibodies, but the actual plasma of an infected and recovered person injected into a new person. And that's an ancient technology going back hundreds of years. Now, those exist and those are fine, but they're not game changers. So we still don't have a life-saving treatment. There are some promising therapies around the corner, like monoclonal antibodies. We hear a lot of noise about them being game changing, but I've yet to see anything manifest in demonstrable evidence yet. I'm confident, but it's not there yet.
And I mean, can you just sort of explain, like I'm 5, like what are these treatments actually doing, and what makes an effective treatment?
Well, some of them attempt to block the entrance of the virus into our cells. Some attempt to block the reproduction of the virus. Some attempt to block the transformation of an infection to a disease state. And some attempt to simply just reduce symptoms. And some are just attempt to just prevent you from dying once you're already on that path. So there's a whole spectrum of approaches being taken. Everybody wants the magic pill. You take it and suddenly you have no symptoms and you're fine and you're not infectious. But that, of course, does not exist yet. And instead, we're going to have a spectrum of possible treatments that we can deploy a variety of different kinds of presentations.
Well, on that note then, Dr. Saxinger, let's talk about vaccines. I mean, I remember once upon a time, these were just going to be the silver bullet, the be-all, end-all. Now, I feel like that hope has almost been diffused in the sense that we don't really know how effective a vaccine would be, how long immunity would last. So where are we at there?
Well, as you alluded to, I think that people have seen vaccines as the way out for a long time now, but there's been some suggestions in the literature lately that maybe the antibody response wanes more quickly than we would like it to. But at the same time, although I think people took that news kind of hard, that suggestion, we still actually don't have a full grasp on the level of antibodies you need to be able to be protected. And we also are just working out how much cell-mediated immunity might affect your resistance to infection. And so with that in mind, I think that the pieces of the puzzle for vaccines are starting to come together. I'm still quite optimistic, honestly. I really am. And there certainly are cases where vaccines actually work better than natural infection at protecting people. There's been a lot of scientific effort brought to bear on this, and there's a number of different types of vaccines in development that are quite promising, honestly, and they're new and they're novel, and we need to know more. But the one final thing that makes me somewhat hopeful is that because of the honestly horrific epidemic that's going on across the world, vaccine testing will be a lot faster than it ever has been for other diseases. When we're trying to test a vaccine against a rare disease, it takes a long time to get enough cases to test it. In this case, there's a heck of a lot of cases, and I think a lot of interest in trying to use vaccines properly and quickly. So I'm still more optimistic than you are, I think.
Fascinating conversation, doctors. I always appreciate your insight. Thanks so much for your time.
Thank you.
Thank you.
And next,